Good morning. I'm David Sanders, and I am hosting today's conversation. Welcome to all of you, and thank you for joining us for this important conversation. As I said, I'm David Sanders with Casey Family Programs. For those of you who aren't familiar with Casey, Casey Family Programs is the largest operating foundation in the country focused on improving child protection and foster care. We believe that strong families in supportive communities are the best way to assure safety for children. Our mission is to provide, improve, and ultimately prevent the need for foster care. We do that three ways. One, we provide direct foster care, preventive, and in-home services. Two, we work with all 50 states plus tribes with a focus on executive and judicial branch practice and policy. And three, we work on improving federal and state policy through legislators. My role at the foundation is our work with states to support our policy work, our research, and our partnerships. I have two of my colleagues here, Christine Kalpin, who is responsible for our policy work, and Peter, sorry about that, and Peter, who is responsible for our research work. Over the next 45 minutes, we would like to provide some context for the recently published policy paper on the subject of a well-functioning child protection agency. Throughout this conversation, you will hear the theme of safety. Safety is a priority for child protection agencies. Safety is also a basic public expectation. The public expects that when children are identified as having been abused or neglected and reported to the Child Protection Agency, that agency will keep children safe. Public expectations are critical in defining the work of the Child Protection Agency. In addition, safety drives media attention towards the Child Protection Agency. I want to be clear, though, that while many equate safety with out-of-home placement, that's not our premise. We believe in strong families in supportive communities, and that's what assures safety. If you remember anything from this webinar, it should be the need to answer the question, are children in your community safer as a result of your child protection agency? I'm going to start by describing the purpose of this paper, including some key points that are important to know about our values in understanding what we emphasize. Second, I'll bring my colleagues Peter and Christine into the conversation. Third, we'll open up to questions from the audience. And then finally, when we close, we'll talk some about next steps. So let me start with the purpose. Child protection is a multi-billion-dollar endeavor in this country. I would also argue that it's government's most important function. Safety of citizens is generally identified as the most important function of government, and child protection is about safety for this country's most vulnerable citizens, its children. Every state and many local communities have a child protection agency. And in some communities, upwards of 1 in every 3 children will experience an intervention of some sort with that agency by the time they reach age 18. In spite of that, as we looked, we were unable to identify any single simple document aimed at the general public that defined what a well-functioning child protection agency looks like. Instead, we find what are headlines that are often attention-grabbing, but may not always be accurate. However, media stories, oftentimes negative, are generally what the public knows about child protection agencies. The headlines are often about compromises to children's safety, children being left in conditions under the supervision of the Child Protection Agency that are seen as inadequate and perhaps even harmful. So the first purpose of this paper is to inform the general public. Second, we look to the paper to provide a starting point for two needed discussions. The first of those is, how do we improve safety for children through policy and practice? Now, if I ask people in the audience, what is safety for children? And what are children in your community safer as a result of your Child Protection Agency's intervention? And how do you measure that? I would get widely differing responses. However, one critical measure of safety is child abuse and neglect fatalities. How many children are seriously injured or killed as a result of a child abuse or neglect incident? What's disheartening is that that number has steadily increased for the last 15 years. So while there are various measures of safety, by one important one, children's safety is more compromised today than it has been at any other time in the last 15 to 20 years. What's happening in your community? At a minimum, as communities, we need to assure that fewer children are dying or being seriously injured as a result of abuse or neglect. How do we do that? That's one of the needed discussions that we continue to have. The second is, how do we better distinguish the Child Protection Agency from the broader child well-being system? Look at these data that are going to be up on the screen. Out of every 100 calls to a Child Protection Agency, only 15 result in child protection services. In other words, the public, in many cases, who are mandated to call the Child Protection Agency in their community when they suspect abuse or neglect, makes 100 calls, but only 15 of those calls result in child protection services. The result, what it reveals, is that many resources are currently devoted to child safety, but are delivered to families who don't want or need the intervention. This results in underservice to families at high risk of hurting their children, including in the lives of families and intruding in the lives of families who don't need help, and alienating them from seeking help at a later point if they were to need it. This pattern angers communities, angers families, frustrates workers, and alienates mandated reporters. We are all concerned about child well-being and prevention. We're concerned about children's education. Are they getting adequate nutrition? Are they developing appropriately? Do they have access to places to play? And many other issues. Child protection agencies play an important role, but are a small part of child well-being. However, it's our contention that we often tell child protection agencies to be all things to all children, when we need to be clear that their intervention is more narrowly focused on assuring children who have been abused or neglected aren't hurt again. The agency must be involved in prevention efforts, but the system, the broader system, including education, childcare, TANF, and other forms of cash assistance, must be involved and must lead those efforts to the extent the Child Protection Agency doesn't focus on improving safety. Safety for children is compromised. Now, let me end with a comment that puts our views into context. We today, children in foster care spend an average of almost 22 months in care. That's untenable and unsustainable. So what we've seen over the years is that we have ended up identifying out-of-home placement as equating to safety for children. And so our interventions primarily focus on separating children from families. We end up intervening through assuring that children are safe from their family, as opposed to assuring that children are safe with their families. What's clear, both in policy and practice, and we believe is the right policy and practice, is that family is at the core of the solutions that we need to assure safety. We need to make sure that children are not in temporary settings without caring and supportive caregivers, and that children are not left in temporary conditions for extended periods of time. Let me bring my colleagues into this conversation, and then we'll continue along the lines of what I just talked about. So let me start with you, Peter. Dr. Pecora is a preeminent researcher and has led Casey Family Programs efforts for many, many years. Peter, the most frequently used intervention in child protection is out-of-home placement. A child is placed out of his or her caregiver's home into foster care or into group care. Does research reveal any interventions that would result in the same level, if not improved safety for children, that allow children to stay with their families and for the families to be treated to assure safety for children? And if so, can you give one or two examples?
Sure. Fortunately, we have research that shows that community-based family supports like crisis nurseries, family resource centers, and in-home services can keep families together safely. And there are intervention strategies like motivational interviewing, family group conferencing, and 3 houses that we know from the slowly building body of research that those interventions engage families in pretty effective safety planning. So we do have the research now that I think is starting to come into play.
So can you say a little about the implementation of those efforts in communities? What you know about how difficult that is compared to building a network of foster homes or group homes, because communities need to make decisions about how they allocate resources. Is this an effective way to actually build supports for families in communities, what you described?
Our current funding structure, I think, handicaps some very hardworking voluntary agencies who are trying to partner up with their public child welfare agencies. They've got to put together rated funding. They're cobbling together funding sources where, frankly, we ought to have a more streamlined, more direct funding supports like we're starting to see with the Family First legislation that gives those partnerships, private-public partnerships, a real fighting chance of succeeding. One of the biggest challenges I think we have in this country right now is we have not been able to scale up programs sufficiently across multiple agencies. And we're hoping that the Family First and other legislation is really going to make a better sense of will really have more of an impact on that.
Thank you. So Christine, and you were one of the real leaders in the country in communicating about the need for change in policy that led to Family First that Dr. Pecora has just talked about. With Family First, which we are celebrating its 5th year, we as a country have begun to fund prevention services. Can you talk a little about Family First? Talk about, particularly in the context of my first question to Peter, does it allow us to intervene in ways other than out-of-home placement?
Thanks. And it is exciting to be 5 years into Family First and seeing a lot of really great jurisdictions leading us in a lot of the work we already had underway. Family First was the result of a lot of demonstration by states and jurisdictions in seeing that as an agency, they were engaging with families that needed something, but they did not need for us to remove their children. That level of engagement was unnecessary. There's a very real engagement that's important to protect the safety of children. And then there's a recognition that the agency oftentimes engages with families that have other needs. And at the federal level, though, our resources only flowed to the states prior to Family First if they removed the child. There was no funding. We didn't value the engagement of the parent. We didn't value the role we know family plays in the well-being of children. And Family First shifts that. It says we can support parents, we can see them as a strength, we can provide them with the necessary supports, and we can keep these children safe. And the federal government will partner with the states in doing that. And I think it has a real opportunity, and we're beginning to see it in shifting when we engage with families and how we engage with families, and most importantly, how we ensure that children are safe.
So you have worked in your history both with executive branch and legislative branch leaders, and we talked about, or I talked about, the importance of safety in the work as we describe it. Clearly, the identification of permanency and well-being has been part of the conversation in child welfare. Can you say a little about what you've seen from policymakers as it relates to their priorities for child protection, understanding kind of what the legislation says, but what do people seem to feel? What have you experienced?
I think, when you talked earlier, David, about the expectation of the community that children are safe, I think the engagement with policymakers has always come from concern that children will be harmed. And it is the fatalities that oftentimes force them to pause and say, is our system working? Are we ensuring safety? And then we get policy solutions that lean into safety. And for a really long time, I think to your point, you said we were equating removal with safety. Fortunately, we know with research, and we know that there are a lot of better ways we can support families. And I think what's been exciting with the policy conversation is we're starting to recognize that we can balance the protection of children alongside supporting parents and seeing that family unit. And I think the fact that policymakers are wanting to recognize and support parents and not just protect children in isolation provides a lot of opportunities for us to think about where the system can really be going and what we're doing.
Peter, and I want to follow up on something we were just talking about, because it has been perhaps the most visible issue. It's covered in some of the headlines that were referenced earlier, and that's children who are staying for extended periods of time in hospitals, or in some jurisdictions in jails, or in offices because of a quote unquote shortage of homes. Can you say a little about what you've seen that could be done about that?
In the paper, we talk about the need for a 5-sector approach. That it's various areas of government, communities, faith-based institutions that really have to rally together. And what we're seeing here with children spending weeks, and in fact, sometimes months in hotel or psychiatric hospital wards because there is an appropriate placement for them that's more community-based, is a breakdown. It's a breakdown in our service delivery system. And this is where child welfare is very much dependent upon behavioral health stepping up and doing its job, and having adequately trained staff who understand the trauma that these children have been through and some of the heartbreak that the teenagers have encountered, and knowing how to effectively treat those children in a community-based setting. Thankfully, we do know that wraparound services, some forms of cognitive behavioral therapy, mindfulness therapy, and other interventions can make a difference. So these children don't need to be staying in these very temporary, in many cases unsafe situations when they really could be served in a more family-like setting with a relative who's been trained up to be a treatment foster care parent, for example, or in their own home with the right kinds of intensive wraparound services. I think we can do better, though child welfare really needs the support of an effective behavioral health system to be right there with them.
So this is an area that has obviously gotten a lot of attention, and one of the things that I have thought and observed about this and have raised as an issue is that oftentimes these are young people who've been in the care of the agency for many years, and that means that they have been in temporary settings, in foster homes and group homes for many of those years, and it seems like in many places the solution is more foster homes or group homes. And I wonder if there is either evidence or at least a hypothesis that those children perhaps need permanent family and would be better off getting supports, as you said, in a family setting. Can you say a little about that? Because perhaps that's an incorrect premise, but it seems to me that more foster homes or group homes are not the solution.
We interviewed over 2,000 foster care alumni. The Midwest study, Mark Courtney and Amy Dworsky, and their Midwest study interviewed a huge number of children and children who were exiting out of care. In our case, it was adult alumni looking back. The heartbreaking stories that they told us just really underscore that if they would have found permanency earlier and gotten the right types of behavioral health services, they could have returned home quicker. They wouldn't have had a drift in foster care. They would have exited foster care to a permanent family situation. Maybe it wasn't their birth family, but maybe it was an aunt or an uncle. Maybe it was a relative with guardianship. In some cases, some of the alumni said one of the best things for them was they finally got adopted. So it's, to your point, timely permanence can, in many cases, address some of the anxiety, depression, and other behavioral health issues that these young people are struggling with. And drifting through 20 foster homes does no one any good. And to your point, if we were able to achieve more timely permanency for more children, and not the 21.7 months they're in average staying in now, but much more quicker permanency, I think we would find children would be less damaged from a mental health point of view, and we would find more children, finding family quicker and not exiting foster care at age 18 with no sense of permanency.
So I've focused on safety and talking about safety, but Christine, and building off of what Peter was saying, the idea of permanency is often separate, but to me they're connected, because permanency means that you at least have a legal family. Now there are many challenges beyond that, but the concern of not having permanency is that as young people, there's not stability and there isn't an assurance that you have a place to go that night. And so can you say, and as well as the fact that it seems that the longer children are in care, the more their safety is compromised from a variety of perspectives. And so many of the young people who are staying extended time in facilities are young people who have had their families taken away, but have not found permanency. Can you say a little about the policy implications of that? What federal policy should be driving what is actually happening, and what your sense is of how this is an issue that could be addressed through policy?
I think it's such an important question, David, because, Peter talked about the research with the alumni study. And I think learning from them about their experience and in particularly their vulnerability in aging out led a lot of important policy conversations of making sure that, were children to age out of the system, they would not be left with any resources. So federal policy now looks at the continuum of their time in care and says, if we are unable to find permanency, we're going to do our best, though, to provide you resources to help you. What it doesn't recognize is the best resource we could provide them as a family. And that if we continue to have a policy conversation, which is an important one, about the role of government in providing necessary supports to individuals, how do we influence that conversation to recognize the most important support is permanency? And that if they do leave the system and age out, we've ultimately missed an incredible opportunity to actually provide them what we know from research, what we know from them, they need. And we're not listening to them if we do this. The youth always, when they are asked, can identify someone who's important to them, who could be supported, who could be that person. And if we actually listened to them and thought about those resources, things would be in a different place and we'd be having different conversations. Much like the fatality data not moving, we still have the same number of youth aging out. And I think we need to be looking at our systems and asking ourselves why we think that that's appropriate. And what that means for the federal policy conversation about we have said at the age of 16, be doing all you can to prepare them to age out. Could we have a conversation about if they are 16 in the system, what are we doing as a system to find their families, to find anyone who can support them and to bring them out of the system appropriately. Aging them out is probably the least desirable outcome, and we need a system and policies that recognize that.
So let me switch, because we've talked about the exiting part, and that's important because of the length of time that children are spending in care. And our paper really looks at that as an important issue. But going to the front end of the system. So we found that a large percentage of children are entering the system because of neglect. And we have talked about the importance of clarity in the definition of neglect, because there are thousands of workers across the country who have to walk into a family's home and decide, is that family parenting appropriately or not? And it appears that the neglect statutes are in many cases vague, vary considerably from state to state. And I've often said that if I had diabetes and I was treated for diabetes in Virginia, I should be able to go to West Virginia and be treated for diabetes. We don't have that with neglect in our system. Can you talk a little about the work that we've done in taking a look at what neglect means across the country?
Sure. I mean, I think to your point, David, we recognize the importance of safety, and we wanted to make sure that we had a really clear sense of how the policy was supporting these decisions. Federal law says we should be looking at serious risk of harm and abuse. And so we wanted to see, well, at the state level, looking across all the jurisdictions, what does this look like? And to your point, what we saw was a real awareness of the concern for children in terms of looking at abuse and neglect, but a lot of language that raised a lot of questions about, who would be making the ultimate decision about whether or not this was neglect. So language such as, that's led to a lot of the conversations from policymakers about, are we intervening with the right families at the right time? Are we in homes that we shouldn't be in? Because this neglect, that definition says, well, you're missing, you may have challenges with a house that may raise questions. Well, we should be talking to the housing agencies, and we should be looking at those problems instead of looking at this as a neglect question. And so being able to go to the policymakers and say, we know first and foremost you want to ensure the safety of your children. What does that mean for how we should be defining safety? And what does that mean for knowing there's incredible neglect cases that will warrant intervention and engagement around safety? And the broadness in which we're seeing neglect raises a lot of questions about when we are unnecessarily engaging and then ultimately removing children. And I think what's been very positive is the interest that policymakers have had in this conversation. I think as we talk to them about the ways their policies impact the decision of a worker, the more they're interested in understanding how they might change that. And I think it's an exciting time for that reason.
So one of the observations that I've made is that that oftentimes a child is identified as having some experience in their home, neglect or a victim of neglect or abuse, and that the agency determines that something different has to happen for the child to be safe. What I'm wondering about is that in a number of those situations, increasingly we're seeing agencies across the country say they don't have sufficient foster homes, they don't have sufficient group homes, and yet we continue to intervene and remove children from circumstances that we have deemed to be dangerous for them. And I wonder if we also looked at, does the agency have anything better to offer? Would that help us to better assure treatment, successful treatment for children versus children who end up in jails or other settings that we've talked about. And I know that there has been some debate across the country and people have taken a look at, is that what reasonable efforts means? Is that what active efforts means? To actually take a look at, do we as an agency or a community have something better to offer to children than their families, which we have said, which we've essentially guaranteed that we do, but oftentimes we don't.
Well, and this is part of the conversation we've been having, I think, as Peter and you've talked about, as we look at all of the stakeholders who play a critical role, the judges, the courts, the lawyers, who play such a critical piece in what we're doing, in terms of making sure parents know their rights, making sure they know if and when they should be engaging and how the appropriate agencies can be engaging with them. And more importantly, the role that the judges and the legal system has in making sure that ideas like reasonable or active efforts are actually being upheld. And then I think from part of the work we know is that those who've really leaned into this are always going to want to know and ensure what they're doing is also uplifting the safety of children. And so if there's not a different option, if there's not a different continuum of resources, if there's not a community agency that's been identified or wrapped around the family, they're left with a very difficult decision of deciding the only thing that I can approve is a removal. And so I think as we move into really looking at the notion of were reasonable efforts provided, which is what federal law says, no child should be removed from a home unless reasonable efforts. Well, we should talk about what we mean by reasonable, and we should start being really clear about what could be provided during that period of time that really is an effort to show that they've recognized the value of the parent and not just check the box, which is a concern we have.
And it seems that that in many cases, we are saying that children are being removed because the family is providing inadequate care. And that covers a lot of issues outside of abuse. I mean, I think there's greater agreement around abuse, but for neglect, looking at the inadequacy of care. And I wonder, and Peter, I'd certainly be interested in your thoughts on this, that oftentimes the same things that the parent has done in terms of inadequate care are what ends up the government doing in not providing some of the basic needs for children. Can you say, do we have a sense of what children need developmentally? And could that be a driver in making decisions about when we extend placements for children versus when we get them back home?
At the outset of our conversation today, I think you harken back to some fundamental principles of child development, and that children grow up best. They develop best in a family setting, particularly their own birth family setting or tribal clan member setting. And I go back to that as like the fundamental foundation there. And we ought to be wrapping around services, investing as much to keep a family together as we would spend tearing them apart by placing them in foster care. And it goes back to some of those fundamental policy decisions that Christine and you have been discussing today. I'm heartened by the fact that parent legal pre-petition, parent legal representation teams that help those parents with the kinds of education and safeguarding of the rights that they need, where there's a peer parent, a social worker, and a lawyer who's very much dedicated to advocating for them. That's starting to spread around the country. It needs more support from a financial point of view. The peer parent programs, I think, are showing that, back to your question, when you provide birth parents with the kind of supports in home that they need, sometimes through a community-based agency or a parent who's gone through the system and wants to help keep them out of the system, some of those programs are having phenomenal success and keeping children safe. And I think we've got some solutions there that can really address this conundrum that you've been outlining about child safety, but family preservation at the same time. I think that's what we're trying to struggle with here.
So we have, I have a number of other questions, but I know we also have some questions from the audience. So let's see if we can pull up some of those questions. And So first question is, how can child welfare better connect with prevention efforts and those directly impacted by the system? Christine, you want to start with that, particularly from what we know in policy?
Sure. I mean, I think this is at the heart of what we have really wanted policy to be directed towards, which is making sure that those most directly impacted are being clear about what their experience was like and what would have helped them. I think what we're learning and where policy and child welfare could be leaning into, and we're seeing this family first, is really questioning whether the child protection agency should be the first point of engagement with the family, right? No, child protection knocking on your door is something that we talk a lot about. Knowing how many families have agencies or partners or resources and in their communities, and you've talked about this, Peter, right? The value of really trying to make sure that, yes, the child protection agency could have a role in resources and protecting children, but could they recognize there are better people or agencies in a community who are really in the position to be trusted, to really understand how best to support families, and how do we resource them in a way that creates a true partnership and recognizes that we're all trying to support each other and really prevent unnecessary separation, and most importantly, support parents in what it is they're trying to do on behalf of their children.
You think about the successes that
Mhm.
Sunset Park in the Bronx has had, or Magnolia Place in Los Angeles, and all the crisis nurseries and family resource centers in Iowa, Kentucky,
Yeah.
You're right. It underscores the value of what you were just saying.
So here's a second question. To what extent do you think the front door or investigatory function of child welfare should engage in and be informed by safety science methodologies? And maybe I can start. That's an excellent question. And for those who may not be familiar with safety science methodologies, what we found over the last number of years is that the kinds of issues that impact child protection, particularly serious injuries of children or fatalities, are low incidence but high impact in communities. And that child protection is not unique in dealing with low incidence and high impact activities. For example, the airline industry has dealt with this for many years. And so there are a set of methodologies that are developed for safety through safety science that have helped other industries improve safety for children, safety for customers or for citizens. And it's certainly my opinion that that child welfare should be fully informed by those methodologies. One of the comments that we've often made, and that I experienced in the Commission to Eliminate Child Abuse and Neglect Fatalities, is that the gap between what we know and what we do needs to be closed for us to improve outcomes for children and to improve safety for children in the child protection system. And this is one of those areas where there is much that's known about safety science and what has worked in other industries, very little of it having been transferred to child protection. And it has certainly been our commitment at Casey Family Programs to both accelerate and expand that transfer. And the last thing that I would mention is that I just mentioned that it's often done specifically around safety, but in one of the conversations we were having earlier, the use of out-of-home placement, we take that as a routine. And so we don't see it as a critical incident, one of those high impact, low incidence activities that drive what happens in systems. But in fact, out-of-home placement is also potentially an approach that could be addressed under safety science methodologies. So we think that there is much work that can be done in this area. Peter, Christine, anything you'd add?
I mean, the one thing I would add here too, David, I think is, the broader question about, I mean, when I hear this is really about the notion that from evidence, from the work we've done, we have really great tools that can be given to a worker to help them in making a really challenging decision. We're asking and giving them a responsibility to determine whether or not children are safe. And we're asking them to really undertake that
And I think it's the methodologies, it's the data, it's leaning into this that's really going to help us also address some of what we're concerned about, which are the disparities in removals and the disparities in investigations, which we're seeing when we begin to look at if we can actually follow the data and look at, the concern we have about risk across populations. We do have concerns that we're engaging with Black families and with Native American families far more than we should be, and particularly for removal. And it's when we begin to bring that data, that evidence, and that information to make sure we're making the right decision, that we also can have a different conversation about how we might address disparities in the system.
So we have talked a lot about the front door as well as children exiting care. One area that I would like to ask a bit about that our paper does touch on is that that if we look at workforce issues across the country, one of the challenges that child protection agencies talk about is not having sufficient staff to carry out basic functions. I know that I've heard jurisdiction leaders say that they have vacancy rates as high as 35 or 40%, unable to recruit for positions and unable to keep staff. But one of the questions that has arisen is, are child protection agencies serving children that are beyond their scope? And Peter, you talked about some of the services that are needed for children in child protection that often aren't available. So the dilemma of having children who have behavioral health needs, but not being served by the behavioral health system, and the child protection agency ends up serving them. And it appears that presents a real challenge for workers, that they feel that they're serving children that they don't have the expertise to serve, and end up leaving the job, don't stay in it. It seems that we need to look at why 15, 20, 30, 40, upwards of 70% of children being served aren't children whose safety is compromised by their caregivers. They are youth who may have experienced that at one time in the past, but now could use other services like behavioral health. Say a little about how you both of you have thought about that issue. Are there things that we can do to help in this issue across the country better?
69% of children reported CPS are reported CPS for neglect only. That might be physical neglect or medical neglect or some other form, but 69% come in the door for neglect. I think, as we've talked about in the paper and many of our colleagues in child welfare are advocating for now, that just doesn't make sense, in the sense that when you dig into some of those family situations, sure, there are a small percentage of those where that child really is at imminent risk and that family is just not able to use the services that they've been offered. Okay, there are those. But to your point, David, we're overburdening our CPS staff. They're going out and traumatizing families unnecessarily when many of those family situations could be addressed through these community-based supports. And we're overloading those poor CPS staff. They're burning out. And you made a point very early on about then we don't devote the time to the truly high-risk families. And where is that good use of our workforce when we can't devote the time to the families who are truly at high risk of child maltreatment, when they're going out on all these referrals coming in, where, as you pointed out, only 15% end up getting any kind of service. So I think we have some reckoning and some recalibration there that really needs to happen, as a lot of advocates are fighting for right now.
One, I think, is you've lifted up a lot of the practice considerations. We know qualified, supported, trained workforce is fundamental to the agency, and how critical it is that that be a component of what we're focusing on. And we also hear from them from a policy level. We look to child welfare as sort of where children should go if they're in trouble or if they need something. When the Child Protection Agency should be where the children for whom there is an imminent risk of safety, we should be engaging. We have children and families in this country, the Surgeon General, everyone is leaning into the real concerns we have right now about behavioral health and mental health. And we're going to need to really sit and look at what our families and communities need. We're going to have to talk to our families and our communities and be willing to listen to them and think differently about where our resources are going. We spend far too much on the deep end. We know this. You remove a child, we will pay for their care. We have to have a similar expectation that if a family needs something, they will get it. We have very promising practices like mobile response crisis intervention services that we're really lifting up. We have states who are really leaning into understanding how they can support families who have behavioral health because of this opportunity. But we should not simply be removing children because they're struggling with behavioral health. We have a whole better way of engaging them. And if we don't engage with them, though, they will be removed, they will end up in foster care, and then the trauma will just be perpetuated. And that's ultimately what we're trying to change.
I know I hear frequently from workers or supervisors that they feel trained, equipped, and prepared to serve infants who are at high risk of abuse or neglect, toddlers who've been hurt and need and the family needs supports to improve their caregiving. But if you look at where they spend the time, it's with 16 or 17-year-olds that are on run that in many cases, and we've seen stories across the country, are not only not at risk of harm from their caregivers, but are at risk of harming others, including workers, and that leads to frustration and to some of the high turnover that we see across the country. And I think that as we talk about the next steps, which we'll get to in just a minute from our report, the identification of the right children, devoting resources to the right children and families to improve safety, it seems to be at the heart of what we're talking about. What's most promising in the next few years that will help us to get there?
Agencies are doing a better job of multidimensional assessment of children and families as they're coming. I think the tools for that, the quick assessment tools, are helping them. They're pulling in the more innovative agencies, are pulling in these multi-disciplinary teams, as Christine was mentioning about those mobile crisis mental health units in New Jersey and elsewhere. So that, I think some of the communities are saying, we can do a better job of quickly assessing and then trying to tailor services for the families. Wrap around Milwaukee, there's been a number of innovative community-based interventions that are springing up and being supported in that realm. So I think those are a couple of the sort of the bright spots I think we could build on.
Well, and I think to your point, David, if we know the predominant reason that a population of kids 13 and older is coming into care is for behavioral health reasons, we have a whole plethora of resources and services that are available. We need to do a better job of being able to connect to them. And I think what's really promising is that we're now, from a policy lens, willing to see families as a strength and not a risk to these children. And if we're willing to lean into families as a strength, then we're willing to think differently about services we provide, about resources, and about really recognizing how we can ultimately protect that child with their family at home and get them the resources they need, right? Which is such a critical conversation right now.
And I am, and I'll leave it as a teaser, but it sure seems that some of the work that Texas has done in terms of legislation that has limited the number of children coming into the front door, really through changing the definition of neglect, seems very promising, and that there is a that safety doesn't appear to have been compromised, and the result will be an agency that's able to focus its attention on that smaller percentage of children who really do need child protection intervention. We have a couple of last questions up here that will segue into in going to the closing. So what are the opportunities available today for community leaders to increase influence over child safety and family well-being? And I would make an initial comment and maybe ask you to follow up, Christine. This is a system that is not driven entirely by federal mandate or statute, that it really is seen as a partnership between states and the federal government. And in many states, or in a handful of states, the counties also play a significant role. And so it appears that there is tremendous ability to impact local and state leaders in looking at child safety and family well-being. And their efforts across the country, certainly the voice of those with lived experience, of lived expertise, is a driver of information and content. Can you, anything else you would expand on in that area?
No, I mean, I think what's exciting is that people are looking for opportunities. I think to your point, it is going to be at the community level that will best address these needs, right? And so the opportunities are for the community leaders to be talking to their schools, talking to their provider network about who are the families you're seeing, right? What are the services? Because what's most important is that we recognize that the families and children we're serving today look different than they did 20 years ago, right? And we have policies on the books that are 20 years plus old and how we fund them. And we won't know how to better direct those resources if we don't actually lean in and talk to the folks who we're trying to help.
I should add, just to build on what Christy mentioned,
We now have some technical tools.
Right.
Geomapping is now becoming more and more common in human services. Casey Family Programs developed the Community Opportunity Map, which is a free resource where you can map a whole over 20 different indicators right down to a small geographic community area. So we've got now tools to help, as Christine said, help these community leaders get a handle on who are the families and what do they need and where are they living
in their communities, so they can
better, as you were saying, David, target the right supports to families when they need them. And so I think we're in a better place now than we certainly were 20 years ago, and we ought to be using that technology.
Well, and we see the communities lean into that. So if you're putting a grant announcement out to fund childcare centers, for example, right? Well, where are your families who are most in need of childcare living? And how can you make sure the resources are going into those neighborhoods or along the lines of meeting the needs of those families versus just a more generic description of this, right? We have the data to really know where we have resource gaps, where the community providers need to be. And so community leaders are completely equipped to direct those resources and to be really clear on where those resources need to be placed.
So I would just go back to what I said earlier in hoping that if there's anything that people remember from this, it should be our children in your community safer as a result of your child protection agency. And it seems like that is in large part the frame that people should be thinking about is as they enter in or continue this discussion, because the agency as it is narrowly focused should assure that children in communities are safer. And so that's the fundamental question. So just to conclude, first of all, thanks to Peter and Christine for all of your contributions, not only today, but really over the last number of years in the lives of children and families. And one of the things that we are certainly interested in following up on is the work on neglect and that definition of neglect that Christine and Peter talked about, and that the work will include continued evaluation, but more importantly, can we identify neglect in a way that truly assures that those children who are being harmed because of their parents' unwillingness to assure supports for them are addressed versus parents who have an inability that may be due to poverty, that may be due to mental health, that may be due to other issues, that those families are not dealt with in the same way as a family who is truly unwilling to care for their child. So there's a lot more work that we'll do to follow up on that. A number of evidence-based interventions that Peter talked about that close the gap between what we know and what we do. It really is incumbent upon all of us to look to those strategies to help as an alternative to removing children as the only intervention that we have to try and achieve safety. And in many cases, we believe far too much is being asked of child protection workers and child protection agencies. How do we bring in the other sectors and other supports to make sure that child well-being and safety are community issues, not just the responsibility of the Child Protection Agency? And we think that the next series of papers, this is the first in a series, begin to address some of these issues. And we think that this is such a critical conversation because, as I said earlier, it is the most fundamental and most significant responsibility that government has. So thank you. Thank you for those of you who participated in this, and we look forward to further dialogue.